So with cough, and this kind of goes for all respiratory problems, location is most important. Imaging there won't be of any help if the problem's in the lungs. Okay. So we've got to get our diagnosis first of all. We want to know the answer to some basic questions. What's the nature of the problem? What is our clinical problem? What's the respiratory rate in effort, and what's the respiratory pattern if that's abnormal? And we've already said if there's a heart murmur, is there actually any evidence of heart failure? Is there an increased respiratory rate and effort? Is there poor exercise tolerance? If there isn't, then we should be very questioning as to whether heart failure is present.
If you're not sure, would you consider doing one of the cardiac marker tests or not?
No. Okay. Biomarkers are not useful for a diagnosis of heart disease. Okay. So if you're in any doubt, take a chest X-ray. Okay. We'll tell you whether an animal's in heart failure. So cardiac biomarkers are really well. Yeah, they're kind of great for cardiologists to see cases that have been suspected to have cardiac disease. The problem with cardiac biomarkers, all of them have been developed and are quite clearly advertised by the laboratories selling them, that the interpretation of them is when animals have evidence of heart disease and corroborative clinical findings to suggest heart failure, not being applied to other patient populations. If you apply those biomarkers to a population that don't have a high, or it's termed pre-test probability of disease, you get huge numbers of false positives. BNP is a classic one. You just get so many false positives with that of animals that don't have any evidence of heart disease whatsoever, having a BNP level that is higher than the reference interval. But the reference interval is in animals with heart disease already determined by them. Never has been. It's something that with any screening, the problem with using things as a screening test, unless they're applied to a population that has a high likelihood of having that disease, you will get lots of false positives. So yeah, so don't use biomarkers as a means to diagnose heart disease. You'll end up with a lot of false positive diagnoses, unfortunately. So yeah, clinical findings are much more important than biomarkers, always. Yeah. The other thing is, yeah, as you say, is something you should like, because if you take that to its natural conclusion, if we can be replaced by a blood test, actually anyone can take a blood test. They can't replace, hopefully, our clinical skills. So if you want to be out of a job, then we rely more on blood tests and less on clinical skills. So, yeah. So basics are important: history, physical examination, because those are the things that we select diagnostic tests to answer a clinical question. And we select clinical diagnostic tests without answering a question, the results of those are going to be difficult to interpret, and they're going to be wrong. So our final diagnosis rests on those foundations. If our foundations are shaky, the diagnosis is going to be shaky, and this is often the case with respiratory problems, that without determining the answer to those questions first, diagnostics can often be misleading. So we've already said that when we're defining the problem, we start with background, presenting problem, and a systems review. Already mentioned this, that we're defining the type of signs, the duration, progression, response to treatment, as well as the background information. With coughing specifically, there are a few questions that are really worthwhile honing in on and asking in every patient with cough. First thing that we always want to try and determine is the animal coughing well or coughing and sick? Okay. It's very unlikely that an animal has, for example, bacterial bronchopneumonia and isn't unwell. If that animal is running around happy as you like, wagging its tail, very unlikely. I don't care what we grow from a swab or a sample. If it's not clinically unwell, it's probably not got bacterial bronchopneumonia. Is the dog in contact with other dogs go, this looks scarily familiar now, doesn't it? It's in face mask dog a few years ago. That was just a kind of novelty slide. It's now what we all look like. Is the dog in contact with other animals that have not been coughing? That's very important from an infectious trachea bronchitis point of view. So infectious trachea bronchitis is so contagious that the presence of other animals in the household that aren't coughing, even a reasonable amount of time has elapsed since coughs developed, if 5 to 7 days have elapsed and they're still not coughing, it's not going to be infectious trachea bronchitis.
What about if some are vaccinated and some are not?
In a household, I mean, potentially you could have. It's unlikely that they're going to be symptom-free completely, even with vaccination. But it's also quite unlikely that some dogs in the household are vaccinated, some aren't. It's. Have you had some? Yeah.